Hello, my name is Jessica Leyva Montes. I am going to talk to you about the definition of the appendicitis. The appendix is a elongated structure found in the colon on the lower right side of the abdomen. The specifically in the segment on the larger intestinal called and second. It might have an immune function but is not an essential organ. The appendicitis is a condition caused by inflammation on the appendix caused by infection or blockage. The blockages can be caused by stool foreign bodies or a tumor. Is an inflammation and infection on the appendix it can present acute or chronic appendicitis. Around acute appendicitis is a condition when the surgical procedures most frequently encountered in the physicians and the surgeons. It the procedure often confused on the most experimented physicians.
Hi, my name is Javier MACÍAS GARCÍA, medicine student. I will tell you about the symptoms that appear in appendicitis. The disease usually begins in a typical and insidious way, characterized by a constant pain, not very intense, with slight elevation and sometimes may present fever higher at 100.4 Fahrenheit degrees. Frequently, the pain present in a generalized form a long duration greater than 3 days together with abdominal distension, decreased both sounds, intestinal paralysis being this one of the most frequent symptoms. The adults may present acute nutritional and deterioration of the general condition. These people usually present symptoms similar to those of other diseases, so auscultation and palpation of the abdomen should be felt, increased peristaltic sounds, signs of abdominal irritation, painful points should at morphine and McBurney.
Hi, my name is Alberto Tapia Portilla, and I will go to explain the diagnosis of appendicitis. The diagnosis of appendicitis is variable, depending on the age of the patient, due to the age, the sex, medical history, and current condition. Number 1. Symptomatology. It's observed mainly the basic symptomatology of acute appendicitis are read described above, highlighting the presence of crampy pain in the right lower quadrant that increases progressively. This alone may be sufficient to diagnose appendicitis in several cases that present intestinal perforation. Number 2. Physical examination. In case where the symptomatology is not enough to establish an accurate diagnosis, it is complemented with a physical examination of the attending physician by palpating the abdomen and identifying the classic McBurney sign and sometimes the von Blomberg sign. Number 3. Laboratory and cabinet test. If this still does not clear the physician doubts, the laboratory and the cabinet studies can be used for the differential diagnosis with other disease. In this case, shall we request white formula and general urine test. But in other case, when the patient is a pregnancy family, shall we request an immunological pregnancy test. And other case when the patient present of parasitosis, the use of imaging studies such as X-rays are of great value for the identification of parasitosis, highlighting the Enterobius vermicularis and Ascaris lumbricoides as causal agents.
Hi, my name is ZÁRATE YUNUETH, and will explain the treatment. The treatment for appendicitis is quite varied. However, factors such as age, severity of the condition, among others, influence the treatment that the physician will choose for the patient. Surgical treatment. The main treatment is surgical. This procedure is called laparoscopic appendectomy. It consists of making a small incision of approximately 1 centimeter and introducing a camera in the right lower quadrant or right ilia fossa to remove the appendix. Antibiotic treatment consists of 2-gram dosage of cefazolin route of intravenous administration with 500 mg dosage of metronidazole route of intravenous administration in only dosage. In the absence of cefazolin, the following is used: 2-gram dosage of cefotaxime route of intravenous administration every 8 hours in adults, 15 mg dosage of cefotaxime route of intravenous administration every 8 hours in pediatrics. But if there is hypersensitivity to this drug, it is replaced by 15 mg dosage of emacazone route of intravenous administration every 8 hours in adults and pediatrics.
Now, I'm going to tell you about the prevention. In general, this is a specific prevention for the appears on the appendicitis. The since it is a disease caused by different factors. The science primary prevention is practically non-existent. The preventive care and the focuses in the second level, and that is about the complication or misdiagnostics.
Prevention. Within the secondary prevention of appendicitis, it is recommended early identification of the basic symptomatology, a correct psychical examination by a psychical and imaging studies thoroughly of confirm the diagnosis.
Likewise, for the prevention of complications due to appendicitis, it is recommended the correct prophylactic management with antibiotics. This is to avoid secondary infection or sepsis as a result of surgery or the presence of intestinal perforation in severe cases of appendicitis.
Rest during the recovery time, which range from 1 or 2 weeks in case of laparoscopic appendectomy and 2 or 3 weeks in open appendectomy. Avoid efforts that can cause the rupture of post-surgical scares. Thank you very much for your attention.